Good evening, ladies and gentlemen. My name is Asavari Sathe. Namaste. I'm the Senior Director for Communications and Access at OPPI, and it is my pleasure to welcome you all to the OPPI Annual Day 2026. This year is extremely special to us because we are celebrating OPPI's Diamond Jubilee. That is 60 years of unwavering advocacy, partnership, and commitment. OPPI's journey has been defined by the power of partnerships, and our legacy is rooted in partnerships with multiple stakeholders. We drive regulatory clarity with our regulatory team, academia to nurture innovation, with the media to promote public understanding, and with the pharmaceutical industry as well. As part of our Diamond Jubilee year, we have conceptualized a film that chronicles OPPI's journey and maps its important milestones. Can we have the film, please?
हम हैं OPPI। हम विकासशील भारत के साथी हैं, विकसित राष्ट्र की ओर बढ़ रहे हैं। हम स्वास्थ्य प्रणाली की रीढ़ हैं, देश हित में काम कर रहे हैं। 6 दशकों से अधिक समय से एक रिश्ता हम निभा रहे हैं। महामारियों और जानलेवा बीमारियों की रोकथाम में सरकार का हाथ बटा रहे हैं। 1965 में आए थे। 1 दशक में हमने वैश्विक मंच पर भारत की आवाज को पहुंचाया, नीति निर्माण में सुझाव दिए, चुनौतियों से लड़कर बदलाव का दौर लाया। संवाद और साझेदारी को आधार बनाकर हमने पारदर्शिता और गुणवत्ता बढ़ाई। हमने सरकार के साथ मिलकर विश्व में भारतीय फार्मा इंडस्ट्री की पहचान बनाई। लिबरलाइजेशन के दौर में हमने सरकार का साथ निभाया। भारत को वैश्विक फार्मा का केंद्र बनाने हेतु हमने पेटेंट सुरक्षा, नवाचार और नीति सुधारों पर ध्यान लगाया। इन्वेस्टमेंट, इंटेलेक्चुअल प्रॉपर्टी और ग्लोबल स्टैंडर्ड्स के साथ फार्मा को आगे बढ़ाया। नई नीतियों और एक्सपोर्ट को बढ़ाने के लिए हमने दुनिया के साथ तालमेल बिठाया। मरीजों की जरूरतों को हमेशा केंद्र में रखा, डिजिटलाइजेशन को अपनाया, शैक्षिक से जुड़े और सरकार को सहयोग कर जन जन तक उपचार पहुंचाया। कोविड-19 जैसी महामारी में भी हमने सरकार का हाथ बटाया। जीवन रक्षक दवाओं व वैक्सीन को देश के हर कोने तक पहुंचाया। ये सफर यहीं खत्म नहीं होता, अभी कई मुकाम पाने बाकी हैं। हमने और हमारी सदस्य कंपनियों ने देश को विश्व गुरु बनाने का संकल्प उठाया है। हम भारत के लोगों की सुरक्षा हेतु सदैव सरकार के साथ खड़े मिलेंगे। हम पहले भी थे, हम आज भी हैं, हम कल भी रहेंगे। हम हैं OPPI।
Anchored in the theme of power of partnerships, OPPI has launched 2 publications to celebrate this momentous occasion: the Coffee Table Book and the Essays on Innovation. The Coffee Table Book is a chronicle of 6 decades of OPPI's contribution to shaping India's healthcare and pharmaceutical landscape. It celebrates OPPI's journey as an advocate for balanced policy and builder of trust among stakeholders in India's healthcare ecosystem. The second book, that's the Essays on Innovation, that's the publication that brings together the independent thoughts of 39 distinguished authors, each sharing their perspective on how innovation can drive our Honorable PM's vision of Viksit Bharat 2047. Both these publications are on your respective tables, and we'll request all of you to go through them. You can scan the QR code that's also here on the screen, and the books are also available on the OPPI website. Now, before we begin, I would like to take a moment to thank our esteemed partners for their unwavering support. To our gold partner, GlaxoSmithKline Pharmaceuticals Limited, and our logo partners, AbbVie, Bayer Pharmaceuticals Private Limited, and Novartis India. Thank you for your continuous support. Now, as we come together to celebrate the OPPI Annual Day, let us begin this special occasion by invoking the blessings of God, by lighting the ceremonial lamp, for which I would like to invite on stage our chief guest, Mr. Nitin Paranspe, President OPPI, Mr. Bhushan Akshikar, OPPI Director General, Mr. Anil Matai, and our logo partners, heads of AbbVie, Bayer, and Novartis. Ladies and gentlemen, light is a symbol of truth, knowledge, and prosperity. As we illuminate this lamp today, may it brighten our path and guide us towards wisdom and success.
वक्रतुण्ड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा।
Thank you so much to our dignitaries. Please join me in welcoming Mr. Anil Matai, our Director General of OPPI, to deliver his opening remarks.
Dear Chief Guest for evening, Mr. Nitin Paranspe, former Sheriff of Mumbai and founder of Atlas University, Mrs. Indu Shahani, my industry counterparts from sister organization Sudarshan Jain from IPA, Dr. Tony Parmar from IDMA, one of our founder members of OPPI when it was formed almost 60 years, the senior most person sitting out here, Mr. Ajit Singh. Several dignitaries sitting out here who have been associated with OPPI. I'll try to take the names, but in case if I do miss out on anyone, please forgive me. We have Keval Handa, Vaidish, who else is there? Okay, maybe I'm missing out on some, but I'll stop with the names there. No, he's my industry, he's my president. They are pointing out to Mr. Bhushan, but former DGs, we have KG, the well-known KG as he is known, KG Anant Krishnan, Dr. Telang, members of the executive committee of OPPI, the CEO of Life Sciences Skill Sector of India, Gautam. Sitting right at the end there is my colleague Bhaskar Iyer, who's been in the industry for long. Sitting next to him is Yugal Sikri. So we have lots of veterans sitting out here, and it's indeed a pleasure, a privilege, and a proud moment for me, along with the EC members who are sitting here, to welcome you all to this 60th year of OPPI. It's our 60th year, a landmark year. "60 years, 6 decades is not a milestone alone. It clearly indicates the depth of the organization, the maturity of the organization, the role it has played in shaping the healthcare and life sciences ecosystem in the country. And we take pride in that in these 60 years, OPPI has played a key role, but it doesn't end at that. We are now responsible for taking it to the next level. India for far too long has been the generic or the pharmacy for the world. But I think a stage has come when we need to move up to the next level. So we as an association, along with our two other industry our sister organizations, IPA and IDMA, I think we all need to play a combined role in moving and shaping the innovative future of the pharma industry. I think a time has come for us to move up the value chain. Our theme for this year is Power of Partnerships. And in no other industry, I think partnerships matter as much as it does in healthcare, because it's one industry where no individual or no individual organization can make a difference. Partnership here means partnerships between industry and government, partnership between industry and academia, partnership between our industry associates, partnership with all key stakeholders who matter ultimately to ensure an improved patient outcome for every Indian out here. So power of partnership is the right theme. It's not only right, it's timely and very apt for the 60th year. And together, I think if we really truly believe in partnership and we work with a purpose, I think all of us put together make an impact in ensuring that we live in a healthy India. So the evening ahead is going to be an interesting one, an enjoyable one, an engaging one, and enjoy this journey. And I look forward to interacting with all of you during the course of the evening. Thank you very much and all the very best.
Thank you so much, Mr. Matai. I'll now request our President, Mr. Bhushan Akshekar, to kindly come up on stage for the context setting. Thank you.
To all the distinguished guests, members of the Executive Committee, office bearers of the OPPI Secretariat, both past and present, friends of the industry, and my colleagues. I have the difficult task of setting the context of a 60-year journey in 5 minutes. But I will try and do justice by picking up just a couple of themes that I want all of us to be mindful of. I think the glue that binds all of us together in healthcare and pharmaceuticals is the ultimate commitment to patients whom we serve on a daily basis. This industry will always be about making a difference to individuals on a daily basis, one patient at a time. And if you look at the 60-year journey that OPPI has traversed, just do a flashback in 1965, population of India was about 490 million. We're almost 3 times. But I think what stayed true in this 60-year journey is our commitment to patients across each decade of this 60-year journey. So I stand here on the shoulders of all the giants sitting in this room, as well as those who are not here with us, who helped shape the pharmaceutical landscape in this country. Very often we take great pride as Indians when we hear that every third pill sold in the world is made in India. But a large part of that credit goes to member companies of the OPPI who really set up the manufacturing footprint early on. So if you look at the innovation that happened for the first 30, 40 years of OPPI's existence, it was all on the supply chain side. And I think that gives us tremendous confidence that not only have we contributed to the patient's well-being, but we've also contributed to creating the ecosystem for pharmaceuticals in India. And I think that's something that I want all of us to always remember. The stated objectives of OPPI remain common. So if you look at the 60-year journey, there are 3 pillars on which we rest everything we do. And the first one is really enable our member companies to launch innovative medicines, vaccines, and services in this country, so that not a single patient of the 1.45 billion that we serve here is left behind. So that remains at the core of everything we do. The second is continue to create equitable access to all patients, because disease doesn't differentiate, regardless of whether you're sitting in a metropolitan city or in the Mofussil interiors. The access to these medicines, which really bring about path-breaking value to patients, are accessible and available. And the third, but these days the most important, is the ease of doing business. I think increasingly we do realize that our job doesn't just stop with bringing innovative medicines here, is to constantly engage with stakeholders across the spectrum to move this conversation forward, and therefore this theme of power of partnerships. Today the dire need is to create an innovation ecosystem. Right? You heard from Mr. Matai that the transition from being a pharmacy of the world to a research powerhouse is stated easily in a PowerPoint slide, but what needs to change on the ground? And that's something that we are all committed to. I think as I scope the next 60 years and beyond for this incredible organization that has really played yeoman's service to the nation, there are 2 or 3 things that remain critical. One is an incredible appetite for all of us, regardless of which companies we represent, which functions we represent, to play up the Indian story, the Indian narrative in our global organizations, because there is so much more to be done here in this country. So that's the first ask I have for all of us as we move ahead. Second is continue to engage regulators across the board. I think in the last few years, the kind of changes that I have seen along with my peers, be it on the regulatory front, be it the announcement on BioShakti mission, be it the formation of 1,000 clinical trial centers, which should supposedly be centers of excellence, there's a lot happening on the external side. And the question is, what is it that we as OPPI can recreate that we did so effortlessly for decades before this? I want to end by saying only one thing, that our work has just about begun. The responsibility from here on only increases for us, especially as we try and create the innovation ecosystem and try and make India the biologics hub, at least in the next 2 or 3 decades. There's no comparison with any other country because we are competing only with ourselves. All the variables that made us successful on the generic side will have to now translate into what we do on the other side in biologics. And I think that's the message that we have. Opportunities will be incredible, and I think it's up to us to embrace those opportunities with open arms. I'm even more happy this evening because I know I've been relentless to request Mr. Nitin Paranspe to be with us this evening, because in him we have a great example of someone who straddled this effortlessly. So a lot more when we hear the keynote address from him and get those pearls of wisdom, so to say, in terms of what is it that's at stake for us individually as well as our member companies. I also want to give a context on the annual day. You know, I've been in the industry for many years, and this day was the most anticipated and awaited event, because this day we celebrate the performances of brand teams across categories which include existing brands, new launches, and I think when I talk of brand teams, it's across the value stream. So I'm sure the next few hours will be very exciting. Congratulations in advance to all those winners whom we will announce. Have a wonderful evening ahead and enjoy the next few hours with us. Thank you very much.
Thank you, Mr. Akshikar, for those insightful words. Ladies and gentlemen, it's now time for our chief guest address. We are honored to have with us a distinguished leader whose vision and leadership have played a pivotal role in driving growth, transformation, and purpose-led practices at scale. In his career, spanning close to 4 decades, he has held many important roles in India and across the globe. He was the CEO of HUL from 2008 to 13, before joining Unilever's global executive leadership team, where he has held various roles, including Chief Operating Officer, Chief Transformation Officer, and Chief People Officer. He is also the Chief Mentor and Operating Partner at Kedara Capital, Vice Chairman at Infosys, and a board member at Heineken and the Indian School of Business. And I'm so happy to say this because I'm an alum of ISB, so it's an even proud moment. Please join me in welcoming warmly Mr. Nitin Paranspe, current non-executive chairman of Hindustan Unilever Limited.
Thank you, Asawari, for those kind words of introduction. You certainly managed to make me feel older than or as old as I am. 4 decades of experience. It doesn't feel true, but that's what it is. Thank you also, I think, to Anil and Bhushan for their remarks at the beginning. It gives me a sense of how significant today is. I hadn't realized this was the 60th Diamond Jubilee event of OPPI, and I know it's a flagship event in your calendar every year, but I am delighted and feel enormously privileged that I have the opportunity to be here with all of you on this very special day. I also got a chance to listen to the incredible contribution that you have made over the last 60 years and sense the desire to keep making even a bigger contribution as India seeks to progress and achieve its Viksit Bharat ambition and the role that all of you have to play. So for all of these reasons, I feel incredibly proud and privileged to be here today. Now, I also realize that it's a day when you're going to be celebrating many of your achievements, successes across the business, and I guess celebrate you must. So I'm going to try and keep my talk as short as possible so that I don't come in the way of you and what you've really come here for. Now, when Bhushan asked me whether I would come here, I readily agreed, I must say. But after agreeing, I did have some questions on my mind as to what is it that I'm going to speak to an audience like this. Clearly, I can't be talking about the pharma industry and trying to give you some deep insights about it because, let's face it, all of you have probably forgotten more than I'll ever manage to learn. Yeah? So that can't be what I talk about. So I then decided that I'd speak to something that I have a personal experience in. Insights that I've got of Unilever's journey in India, a journey that spans over almost 100 years that it's been in this country, and try and distill a few lessons, a few insights that has enabled this company to be a successful and a formidable player in India. And having done that, I leave it to you. I leave it to you to see if there are any parallels out of what I say which might apply to the pharma industry as you find yourselves at this stage. Yeah? So that's really what I'm going to do. Now, as I talk about Unilever and HUL, I must absolutely and unashamedly say that I'm biased. So I will say it the way I feel it, so take it with in that spirit. Now, when I look back at why Unilever has succeeded over these years. And if there was the one thing that I would begin by calling out is what I would say the power of conviction. Conviction before the opportunity becomes obvious. Conviction well before that. Now, I mentioned a short while ago that the company came to India about 100 years ago, when the last thing that you would think of was having conviction about India. It was far from obvious. Because let's face it, 100 years ago when people came in, all that existed was a large population, but a population with no purchasing power, which meant the market in theory but not in reality. The business environment which existed was tough. It wasn't conducive. Not just when we entered, but for several decades after that, the business environment was hardly conducive. And yet, the company committed. Yet there was this strange conviction that this country can be a very sizable part of Unilever and we can build a very strong business out here. This sort of conviction is rare because it requires you to invest. And having conviction is important, but conviction alone is not enough unless you do something about it. Unless you have the willingness to invest, unless you have the willingness to create a market and not just wait for the market to develop. And that brings me to the second theme that I want to talk about, which is if you want to create a market, the one imperative is the need to build local relevance. It might sound obvious. It might sound absolutely obvious that you cannot rely and you cannot assume that Western products, Western price point, Western business models, Western assumptions can simply be brought here and made to work. And yet, obvious as it sounds, there are far too many companies that I've seen over the last few decades which assume this to be the case, and that's why I'm calling this out. Now, it is to the credit of many people who came in this company decades ago, most of them British expatriates at that time, who realized that we would not be able to build a business by simply importing Western assumptions, Western models. But realizing this is part of the solution, but then recognizing what would be needed. If we had to build products offering price points, business systems for India, you needed Indian talent. Why? Because you needed someone who understood the complexity of India, the diversity of India, the many paradoxes of India. Someone who could be deeply in tune with the cultural ethos of India. Without that, you didn't stand a chance. And if you needed that, you needed local talent, like I said. But where would that talent didn't exist 5-6 decades ago? There were no business schools around. And that meant that the company had to go around scouting for young, bright, talented individuals with no background, but bring them in and start training them. And if today this company has built a reputation of being a leadership factory, it is only because somebody several decades ago started on this journey and almost made it a part of the DNA of this organization. In fact, this conviction was so strong that you won't believe it. In 1961, 4 years before the OPPI came into existence, the first Indian chairman was appointed. And since then, in the last 65 odd years, other than a 2-year period in between, every single person who's run the country has been an Indian who's been around. So that just gives you a sense of how deep the commitment was to talent, but the recognition that unless you build local relevance, you are unlikely to succeed in this place. Now, that was the second point I wanted to make. There's a third point I wanted to mention, which is about innovation. Innovation is a big theme that I heard just now. And you know what? Our realization has been that innovation is much more than product. We need to innovate on our business models. We need to innovate on, in fact, I would go on to say that while HUL has brought many impressive products to this country, probably its best innovation, or most significant innovation, has been the way it has learned to make money in a country like India. Because that is not easy. When you are addressing the Indian consumer at the price points which are required, it is clear that you can't have models which existed in the past. It is clear that your margin structure is likely to be compromised. Because we first started off with what can the consumer pay, and then worked backwards to solve for everything else. Innovating on costs, innovating on our supply chain, being absolutely relentless, and in terms of business models. In the late 80s, early 90s, I just joined the company. I could not imagine how when we were forced with our back to the wall, we had launched a product which was Wheel, and our margins at that stage, our operating margins would have been in low single digits. Now, how do you run a business like that? And yet, the company figured out a way to make exceptional shareholder return while making low single digit operating margins. Why? Because we found a way to do this with virtually zero capital. Negative working capital, zero fixed capital allowed us to run this business, creating mathematically an infinite return. An infinite return with running a business at those low margins. Something unthinkable in a Western context which we were around. But it required a very, very different mindset. And the fourth lesson, and the last one which I talk about, is what I would call resilience and the absolute discipline to do the right thing always. Resilience is relatively straightforward, because if you have to operate in India, and all of you have been doing that, you would realize that the journey is never linear in a country like ours. I often say it's 2 steps forward, 1 step back, and in bad times it's 1 step forward, 2 steps back. That's how the journey has been. And therefore it requires belief. It requires conviction that the secular outcomes will be positive and moving in the right direction. And it requires the capacity to stay the course in bad times, in difficult moments. Yeah? That's resilience. But it also requires the discipline to always do the right things. I can go back in my history and think of numerous occasions when the temptation to take shortcuts would have been very high. Many temptations. And not doing so meant a short-term cost. It meant delays, it meant frustration, it meant assets lying idle, it meant a factory remaining uncommissioned for months. Why? Because somebody expected speed money for that last connection or approval letter which had to come. And we said, we simply won't do that. And I think those decisions taken by my predecessors many years ago have paid us back, because in the end, we won grudging respect, reputation, and over a period of time we learned that reputation compounds, integrity compounds, trust compounds, and the benefits of that you see over a period of time. So those were some of the lessons that I think, nothing to do with me, all of these leaders who've preceded me came in and have put in place, as a result of which some of us got the opportunity to keep building and making this company what it is just now. Now I say all of this, I started right up front saying I'm going to share some of this. I'm not sure how much of it is going to be relevant to any of you. But maybe some of it is, maybe if it is not, and I'll leave it to you. But I'm going to move on to say a few words about the pharma industry as I see it. In fact, I have to say, when I started working in the late 80s, before that actually, I must say, like Unilever, many of the companies in this room were relatively early entrants into India. And when I started working, probably the entire market was dominated by companies in this room. Shares, probably over 80-90% of the share of this industry was made up of global multinational pharma companies who were here. As I say a few things, it might sound provocative, and if I say something which some of you find offensive, I apologize up front. It is only in the spirit of trying to encourage you to think of the next 60 years a little differently. So, you were early entrants, but I suspect, and as an outsider, the lens with which many companies happened to see India was somewhat cautious. Probably for good reason, I can only surmise what those were. Probably seeing India as a large population but limited ability to pay. Probably seeing India as a complex regulatory environment. Probably being somewhat concerned of some of the business practices that were in place at that point in time. And probably because each of these companies had more attractive, easier to address markets elsewhere in the world. And probably a combination of all of this meant that these companies, all of your companies who were here early and had built a sizable presence out here, were somewhat cautious and waited for conditions to get a little better, where they could feel a little more comfortable doing business out here. And it is in that period some other companies saw an opportunity. Many domestic Indian companies came of age at that point in time, and over the last 2 or 3 decades, they built scale. They captured market share. They shaped an ecosystem in that period. And from a situation where companies here were occupying or had probably 80-90% share of the market, today, I think it's somewhere down in the mid-teens. That's quite a significant erosion, we have to agree. And the question really that each one of us has to ask ourselves is, what is preventing global pharma companies to committing more wholeheartedly to India? Is it that we are still evaluating India with an outdated lens? Because the India of today is very different from the India of 20 or 30 years ago. India is growing. Affluence is increasing. Healthcare awareness is going up. Systems are getting stronger. Standards are getting better, are evolving. And even more importantly, there is little doubt in most people's mind that the next decade or two will be of countries like India in the world. So, if we are not committing to this opportunity, it is less to do with the market, in my view, but more to do with our mindset and our willingness to embrace the fact that addressing this will require a somewhat different approach, a different business model, and that's not always comfortable. Why? Because if we have to address this market, it will mean the willingness to accept that our price points here will be somewhat different from the rest of the world. It will mean that we will have to find models which will create value differently from what they have created elsewhere. It doesn't mean that we have to accept lower value creation or lower returns from here, but the way it has to be done and the way it can be done will be different. And that's not easy. That's an uncomfortable thought for many of us. Therefore, I'm going to give you just one example, and I can understand that discomfort. I have dealt with it and I've seen it. I remember the time when in HUL, the first shampoo sachet was planned to be launched. That sachet, 1 rupee, we still sell some sachets for 1 rupee. Imagine, 1 rupee is $1 cent. Yeah? Imagine 100 such sachets to be given in $1. And imagine trying to explain to a Western mindset that we're going to sell it for 1 cent. And in 1 cent, you have to bear the cost of the product, the cost of the packaging, the distribution across the length and breadth of this country, the taxes that you have to pay to the government, the margins to the distributor, the margins to the retailer, and yet have something out of this 1 cent left to yourself to make some money out of it. This is absurd, is what people would say. And yet, And yet it was possible. It was possible once you started thinking about it and relentlessly innovated. And that's why I started saying that innovation is much more than product. In this country, to succeed, innovation has to be thought of more holistically across the value chain to be able to create value in this state. Now, which brings me back to all of us once again. What is the role that each one of us has got at this moment? The leadership teams of these companies, all of you sitting in this room, you have an incredible opportunity and a responsibility. And your responsibility is not just to run your India businesses. Your responsibility is to reframe. It is to interpret India differently for the rest of the world. That's your responsibility. It is to help global headquarters see India through a different lens. A lens which will suddenly show opportunity rather than all the problems which are there. It's a question of what lens you use. That's your responsibility. It is a responsibility to build conviction where there might be some skepticism. It is a responsibility to demonstrate that different business models can exist which can create value. That it is possible to run a business with seemingly different margins and yet create exceptional returns. That's your responsibility. And you know what? You are blessed. You're blessed because you're in an industry where it is still not too late. In other industries, if you were sitting at a cumulative share of about 15%, you would say probably the train has left the station. It is very, very difficult to claw back. But not so here, because the innovation intensity of this industry is such that it is possible to claw back. And why do I say that? Just take the recent success of Mounjaro. In a short period of time, for Mounjaro to become the number one, similar to Augmentin in this country, what does it say? It says when you come up with something, you get the pricing, you get the model right, this opportunity exists. And that's really the calling for each one of you. So I'm going to end with only one last thought for all of you, which is don't wait. Don't wait for India to become a market that you will be comfortable with. Build the capabilities to succeed in the India that actually exists today. Because the future belongs to those who will do this. I wish you all the best. I wish you much success. And I wish you the opportunity to create the India that you deserve and the India that all of us want. Thank you.
Thank you, Mr. Paranspe, for your straightforward views from brand reputation and innovation to the Indian market landscape mapping. But as the stage is being set up for our leadership dialogue, I would encourage the audience to kindly go through the two books that are kept on your table, the coffee table book and the essays on innovation. You can glance through them and you can also download them from the OPPI website. And may I request our President, Mr. Bhushan Akshikar, and our Chief Guest, Mr. Nitin Paranspe, to kindly come up on stage for the leadership dialogue.
The stunned silence in the room tells me that you really struck a chord. First of all, I want to thank you, Mr. Paranspe, for a masterclass in what each one of us has to do as flag bearers of this industry. We didn't want to lose the chance of him being here as the keynote speaker and the chief guest. I want to take the opportunity to really ask him a few questions around a few topics, because in today's world, where Mr. Paranspe, it's difficult for individuals to stay in one company for 37 months. You carved out a remarkably inspiring journey over 37 years. So that's where I want to begin first. I'm sure this journey must have been fraught with ups and downs and twists and turns. And very often when people ask you to share your success stories. There must be tons of them. I want to begin by asking you, and today it's very commonplace to talk of, a career ladder that's not linear. But when I reflect on your career choices, you've done many things which were probably at that point very different. I want to start by asking you, are there any failures that shaped you apart from the successes?
Several failures. Hello. Yeah, I think there are several failures, Bhushan, inevitably. But a comment on the lighter side. The fact that I stayed for 37 years is evidence that Newton's law of inertia still holds. Yeah? But listen, you can't work in any organization without experiencing moments of failure. I did too. Quite a few of them. But I'd probably call out this one which I'm going to talk about because it was a huge failure and it was my first failure. And as a context, and I'm going to say this not wanting to sound immodest, but after joining the company for about 12, 13, 14 years, I was very successful, some could say wildly so. I hadn't missed my targets for the first 14, 15 years of being in the company. And while that's good, but it also is not so good because I was wholly unprepared for what might happen later. So in 2001, I got into a role, and if I hadn't missed a target for the first 14 years of my work, in the next 2 years, there was not a single target that I committed to which I was able to deliver. Targets set at the beginning of the year had to be revised by April. What I said I'd do in April by June was impossible. What I said in September was by the end of the year, even that was not delivered. So you can imagine what I went through in that period. Extreme angst, extreme frustration, self-doubt. There were periods when I would wake up in the middle of the night, not manage to fall asleep, simply not knowing what else I could do. I tried every trick that I'd learned. Nothing seemed to work. And I was losing sleep for sure, and I started losing hair as well, I think, yeah? At that stage. And it was in one of those nights when I woke up at 3:34 and I was tossing in my bed, unable to fall asleep and feeling absolutely helpless because I simply didn't know what I'm going to do going to office. I had nothing else left to try. And at that moment, something snapped. Something snapped in the sense of I said, I surrender. And surrender not in the sense of giving up, but surrender in the sense of not worrying too much in terms of what the outcome will be. And I simply said, just go, do what you think is right, and don't worry about the outcome. That's really what happened at that moment. And I went to office in a bizarre way. I felt lighter than I'd ever felt in the last 18 months when I was dealing with this issue. And in a strange sort of way, I started doing what I thought was right, and results started coming. And in 6 months' time, we were seeing a turnaround, etc. And the question that went through my mind is, what happened? I reflected a lot. Why did I fail? What was going on? Etc. And there were 4 lessons that I got out of that failure, which I thought I must share with all of you. The first one was, always do the right thing. There are simply no shortcuts to success. And it's something that I've believed growing up. I've always believed that, for me, doing the right thing is like a law, that when you do the right thing, right outcomes follow. For me, it's like gravity. Just like when you drop something, every time it falls down. I've always believed that when you do the right things, the right outcomes will follow. And shame on me, for that 18-month period, I did everything but the right thing. The problems were structural in nature, needed a strategic response, and I was doing tactical stuff. It simply wouldn't work. There was no question about it. So that was my first lesson. The second lesson was coming out of one more thing. Why was it that I was not doing the right thing? Was the problem so complicated that it took me 18 months to figure out what to do? And when I look back and say, holy shit, no. It was blindingly obvious what needed to be done. And yet I hadn't done it. Why? Because I thought I was too smart, I was too cute for myself. If it was going to cost a lot of money, I thought I could do it in less money, I could do it faster. And I realized then that however expensive a solution might be, the cheapest it will ever be is now. I delayed taking the tough calls early on because they were expensive. 18 months later, they were far more expensive because I'd allowed that issue to linger on for that period of time. So the second big lesson was, however difficult it is, however expensive it is, the cheapest it will ever be is now. The third lesson I learned, again observing my own behavior. In that period, I did everything that you should not do. I behaved like a victim. I was in denial of the problem. I first did not even acknowledge how serious the issue was which required a response. Complete denial. And then I behaved like a victim. Not my fault, market is not good, predecessor has left me, all of this. And I learned at that stage, and I said to myself, never a victim, never in denial, is not just a good for business, it's also a good life lesson to live by. And the fourth thing I realized, based on how I was feeling at that point in time, I was destroyed. My confidence was absolutely at rock bottom. And I realized why that was happening, because I was attaching too much importance to the outcome that I was delivering. And I realized you are not your result, either good or bad. And it is only this conviction that you are not your result which allows you to go through these bad periods without having your self-confidence destroyed. Because if your self-confidence is destroyed, there is no chance you will succeed. But it is also this conviction and belief which allows you to go through your good times without getting a swollen head and thinking you're God's gift to mankind. Yeah? So those were my 4 lessons. And every time I have strayed or from any one of these, I've paid a heavy price.
Very powerful life lessons. Can I have a round of applause from all of you? I think, again, I saw several heads nodding there in the background. That just tells me that, all of us go through these similar experiences. The question is, how do we respond? As we always say, when you have your ups and downs, your character doesn't change. I think that was very powerful. You've done so many things in your life, from joining as a management trainee to being the chairman, to being on the executive committee for 11 years, being the youngest CEO of Unilever in India. If I were to ask you to characterize, and the reason I'm asking that question is, for those in the room who still remember, Mr. Paranspe was at an OPPI event probably 18 years ago. And there was a question that was asked. That room was full of brand managers, and somebody had asked him, what should we focus on? And his answer was very simple: focus on your current job. My question to you is, how do you keep yourself curious with everything that you achieved, including the current role of a vice chairman of Infosys now?
I'm saying you just have to be honest with yourself, and you'd realize there is so much more that you don't know. There is so much that you have to learn. And unless in today's world, more than any other stage, if you do not remain hungry and curious and wanting to learn and relearn, you'll become irrelevant very soon. Yeah. In my case, it happened easy because, again, it will sound, I don't want it to sound badly, but the reality is, I do not see myself any differently from a very ordinary person with above average intellect at best, but desperately hungry to be a little better every day. So the only thing that I bring is wanting to be a little better every day. And I've always hated the advice that people give you, that you must try and be the best in the world and best in the world. And that's terrible advice, because in a world of 7 billion people, how can you ever be? There will always be someone who's going to be better than you. So why try? But the moment you say that I want to be the best version that I can be, I want to be better than what I've been yesterday, there is no limit to this opportunity to get a little better. So I've embraced this philosophy that simply allows me It first helps me acknowledge how much I don't know and how much I can learn from every single person. This is not a loose comment. I genuinely mean that. And that just keeps you humble and grounded and wanting to learn a little more.
Very powerful again, very powerful. Yeah, please. Well, I know there are a lot of ex-Unilever alumni sitting in the room, including Dr. Hasid Joshipura sitting at the back. And I've always heard about the culture that Unilever has always had. The culture of no pomposity, the culture of always doing what is right for the organization, but also more to the customers and the consumers that you're serving. And therefore, I want to pivot to the second theme around culture. You've created a culture. I mean, the financials are an outcome. For a company to be 65,000 crores or more in annual revenues in India, the market cap in excess of 650,000 crores or what have you. How do you go about any nuggets for the young and the not so young people in the room in terms of what is it the call out for us in terms of shaping the cultures in our individual organizations?
Listen, this is a very broad question. It will take forever to discuss this because everyone recognizes the criticality of culture. All organizations go through periods of culture change and things of that sort, and yet most culture change initiatives fail. My reflections over this is that often we get a few things wrong. Sometimes culture and culture change initiatives become the responsibility and fads run by the HR organization. That's a problem. Culture has to be owned by the CEO of the organization, not the HR part of the organization. And then the question is, what is a good culture? And I think we again make a mistake at times thinking about it. And I'll give you some examples. We all think that a culture, if you had a culture where everyone has a voice, everyone can speak up, everyone can debate, everyone can express an opinion, is a good culture. Now, maybe it is, maybe it is not. And I'll give you a simple example. If you were running an army, if you were the head of an army, is this a great culture to have? No. Because in the army, what you want is a culture of uncompromising discipline, unquestioned obedience. When you get an order, people follow. They don't sit and spend time asking 5 questions, is this a good? Because a second delayed is the difference between life and death. I use this deliberately an extreme example to show that culture that is required is contextual. And therefore, I define culture. You need the culture that amplifies your strategy. So thinking of culture in isolation of strategy is a big mistake. So figure out what is your strategy, what will help you win, and then define a culture which is wholly consistent and will give the best chance of that strategy to succeed. 2 quick examples. If you are Walmart, we know that Walmart's entire proposition is around cost conscious, is about being the cost leader and offering the lowest cost products to its people. That's its reason to exist and its point of difference. So Walmart then creates a culture where thrift, where cost consciousness, where frugality is deeply valued. They do everything. Their offices are sparse, nobody will travel business class, and they do everything which is consistent with that. Some people don't like it. If you don't like it, don't join. That's okay. They make those choices. But coherence between strategy and the culture. Now, cost consciousness is important, but if you're Apple, for example, is cost consciousness not important for Apple? No, it's important, but what is more important is innovation. So if Apple tried to run an organization like Walmart, would that be appropriate for Apple? Absolutely not. Apple needs to create a context where innovation will thrive. And this is, so the question I'm saying is, don't think of culture in general terms. Figure out what's your unique point of difference by which you want to win, and then start figuring out what's that culture which will magnify that strategy and give it the best chance of success. And I think therefore the CEO must own culture and not relegate it or delegate it to somebody else.
Very powerful again. Thank you very much for that. People are making copious notes as you're talking. I'm going to shift the gears now because I'm also conscious that everything that we do, whether it's the pharmaceutical industry or the FMCG, eventually we have the patients at the core or the consumers or customers. In today's context where inciting customer centricity still remain at the core of everything we do, what's your assessment of where technology is helping us shape all of this, especially in terms of the agility, the decision making? Any call out to the young brand managers and the brand teams in this room?
Firstly, listen, I think there can be no organization where this won't be the central conversation going on in terms of what's happening with technology, how is it going to change the way we operate, the way we behave, the impact on our roles, the decision making. So this is reality. I think only time will tell how this will pan out in specific terms. But irrespective of this, some things remain unchanged. Technology may change how we do things, but success will still require you to be obsessively focused on delivering on what consumers will need. That is not going to go out of fashion. That's for sure. Yeah? So the only thing that we have to figure out is what do we need to do and how do we leverage technology which exists today to get the right insights, to be able to serve faster, quicker, with agility, to be able to serve the consumer better than anyone else. And the people who do that will be the people who win. Technology will be a means and a tool to enable us to do that. Nothing beyond that. And I think, but the technology changes are not trivial. Yeah? They're probably the most defining conversation in every organization will have to be around that, because it will require rewiring and rethinking of everything that we've done. And I don't think the challenge there is intellectual. I think intellectually we all get it. The challenge is all of us. We will all feel threatened. We all are conditioned with decades of working in a certain manner. And in a way, while large companies have many advantages, they are singularly disadvantaged when it comes to this, because they're dealing with the legacy of what exists at this moment, while small companies have no background, they have no history, they have nothing to dismantle, they have very little resource and everything to disrupt others. So I would really say that's a challenge in terms of how we deal with.
No, thank you very much. I know we could go on for several hours with Mr. Paranspe sitting here. It's indeed a masterclass to have you. And when I reached out to you, this was the reason, because I know for a momentous occasion like this, and to stay relevant as OPPI, I think there couldn't have been a better person than you to come as the keynote speaker for us. On behalf of everyone, I just want to thank you immensely for being here, sparing your time, and more importantly, spending time with these thought-provoking ideas, and of course the call to action. I'm sure next time we meet you, we'll have more stories to share apart from the ones that you picked up with the GLP-1 analogs. I'm sure innovation is what will drive us even further. Thank you once again to you for taking our time.
Thank you, Mr. Akshikar. Thank you, Mr. Paranspe. May I request Mr. Akshikar to kindly present a token of appreciation. Thank you once again. Ladies and gentlemen, now it's time for our fireside chat for the evening on a topic that continues to shape conversations across industries. That's AI in healthcare. Get ready for an inspiring dialogue that's sure to leave you with plenty to think about. The moderator for this fireside chat is Mr. Sampath Srinivasan. Sampath is the Senior Director, Commercial Data and AI Excellence at Novo Nordisk. And Sampath will be joined by two esteemed speakers who have paved the way in the field of AI and revolutionized healthcare. Mr. Prashant Tandon, co-founder and CEO Tata 1mg, and Mr. Prashant Warrior, co-founder and CEO, Cure.ai. Together, they'll share their insights on how AI is transforming healthcare from innovation and access to patient outcomes. Please put your hands together for this amazing panel, and we'll request the panelists to kindly come up on stage.
Good evening, everyone. It's a pleasure to share the stage with these two gentlemen who are really, very prominent in their field, require no introduction. As I was preparing for this session, I looked back at past 1 year, and some of the stories stuck with me to set the ground or the context for this discussion. AI, in pharma, in general, healthcare or life science, right? Starting from research, where some of the, ex scientia medicinal chemists quoted that they are moving away from molecule makers to AI collaborators, which is they no longer go to the whiteboard to design molecules. They take the output from models to study and shortlist the ones that are already vetted for safety and pharmacokinetics, right? And if you go further down the value chain, when you get into clinical operations, I think Novartis posted that they brought down the protocol generation time by 87% reduction, right? And further on to the commercial side, brand managers in top 20 pharma companies had a forum where they talked about, they no longer debate, reconcile the affiliates provided forecast. They spend more time on deliberating and scenario planning and actioning against the baseline that's set by models that take data from CRM, SAP, or ERP, and market insights. So with that as some of the stories I was reflecting on, I'm sure you will all agree with me in saying that AI is not a buzzword in pharma. AI is an evolution, right? So with that, I would like to sort of turn some of the questions over to a couple of Prashants here. For all practical reasons, I'll address Mr. Tandon as PT and Mr. Warrior as PW. So don't want to confuse people by saying, the same first name. The segment, we are going to go through 3 segments. I've jotted down a couple of questions which I thought might be of interest for this audience. And the first segment is going to be around real life decisions that these gentlemen have taken and what we could learn from their experience. And the second segment is varying leadership lens. We as individuals, what responsibilities do we carry in the world of AI, right? And we'll close it with, what, as a nation, as a country, how do we sort of advance the partnership in the ecosystem of healthcare, where the lines are getting blurred between pharmaceutical and diagnostics and care services and so on, right? So with that, we'll have 3 segments, couple of questions in each segment. We'll have 15 minutes for Q&A for you to raise anything that you might have on your mind. I would like to start off with the first segment, if I can turn it to you, PT. Pharma companies run so many pilots that not necessarily scale, right? At Tata 1mg, how did you decide where AI should be deployed, and more importantly, where it shouldn't be?
So I think our DNA, and that's the DNA of consumer-oriented digital companies mostly, is that failure is actually a great thing, and we keep doing pilots and keep failing, and keep learning and keep doing more pilots. So I think A/B test is something that we do for pretty much everything. So before we kind of deploy any feature big, it goes through A/B tests, and that's routine for us. So now, in terms of AI, I think it's for us it was very clear. Actually, when we started work on AI, the first area we started doing work was on disease progression models and trying to figure out if we could get longitudinal data to start speaking something, and it was purely exploratory. So that was one dimension that was happening, and this was well before the large language models became as popular as they are now. So we started working on that layer. Once the power of AI through the LLMs became real, the Chat GPTs and Claudes and all other common platforms that we hear about, a lot of things became just apparent that, okay, this thing can be done so much better. And when you hear AI, it's a big word, but you need to understand very clearly that, at least the way I look at it, there are three distinct areas of use of AI. And so sometimes it is assistance, where it is an assistant which you have to tell what you want it to do for you. In second case, it is augmented, so it augments what you want to do through the input that it brings by itself. And third is autonomous. And I think the journey of which part of your business, which part of your processes and systems are ready for which of these three is something that you have to figure out along the way. But it reasonably succeed, which anything that is important from a perspective of the impact on the business, you would have much more manual supervision at this stage. Anything that is much more logic-based, flowcharts that are straightforward, very easy to automate in any case, and with AI, you can go a step better and automate it better. So the assistant, AI as an assistant, I think is a no-brainer today for pretty much anything that follows any kind of logic or any kind of pattern, which is 99% of what organizations do. So using AI as an assistant is pretty obvious in everything we do. Now, where do we want it to augment things? And the biggest challenge is, what are the areas where autonomous AI can actually take shape? That is where you need to be a lot more, I would say, thoughtful, deliberate, and considerate.
Thank you. Would you say any AI initiative that you thought was going to be successful, but it proved out to be otherwise, that you stopped investing on and you have given up on AI is not the right fit for this area?
We don't give up. It's iteration. So many AI initiatives didn't work out. They don't work out and same for all initiatives. So I don't look at it as we need to give. I'll start with the most interesting one we have been working on since 2018, which is digitization of the doctor's handwritten prescription, which was and is a very complicated problem. We've, in fact, worked with academia at IIT Delhi on figuring that out. We got close to, I would say, 80-85% success in. So the assistive part is working well. Augmentation is also happening. It's not reached a stage where it can be automated. Our early models would fail repeatedly because, as you can well imagine, it's not an easy problem to solve. But that only teaches us more about that the next time you look at it, there's a better way to do it. And then suddenly we realize that the technology has moved so fast that it's actually very doable today. And now, and just how it impacts my business very directly. Patients click a picture of the prescription, comes to our system, a pharmacist then looks at it, digitizes it. Now most of the digitization is done by the system. The pharmacist still reads, completes what is missing and all of that, but what used to take 3 to 5 minutes today takes around 15 to 20 seconds. And that is pure productivity in my business. So things like that. Now the question is, from 2018 to 2026, we've been continuously failing. And, or you can say that that's the way to do it, there's no other way to do it. So it doesn't work the first time, but that doesn't mean that the technology is not moving here at this kind of a pace. It is going like this, and suddenly another step jump, another step jump. So you really need to revisit all your failures and see that, okay, maybe now is the time. Maybe that time it was too early.
Now that's very inspiring. Thanks for sharing that. PW, over to you. Healthcare is a trust business, right? When we speak of AI and automation, how do you balance automation with human oversight for areas that cut across, medical advice, pharma or diagnostics? How do you balance these two, automation versus human oversight?
See, I think like PT said, most of AI today in healthcare is assistive in nature, especially in clinical workflows, right? AI is not ready for full autonomy in clinical workflows because it can hallucinate, it can make the wrong decision, and it is always predicting the highest probability thing, right? And when you look at high probability events, disease is very low probability, and especially diseases like the things that we work on, lung cancer, or some of those are very low probability events. So the probability that you predict those, AI does that prediction or diagnosis accurately is lower. That's why you see a lot of hallucinations, and mistakes are made, right? So typically, so for us, what we do at Cure and the AI tools that we build out for clinicians across the world are typically assistive in nature. And in that sense, what we try to do is integrate into the physician's workflow, whether it's a pulmonologist, radiologist, neurologist, right? We integrate with medical records, EMR systems, we integrate with the PAC system. We sort of show up on the radiologist workflow. So how we operate, for example, is one of the things that we do is if a radiologist is reading a scan and there is a nodule, for example, in that scan, whether it's a chest X-ray, chest CT, a small Q will pop up on their screen. And now they open that and it will show you exactly where that nodule is. It will give you more details. You can go in, dig more, dig deeper, look at past scans. So it's sort of making it invisible. And think about Gmail, for example, or all of the AI tools that we already use, have been using, right? Google Maps. AI is invisible. It's a tool that you use and the AI is invisible there, but finally you have to use your judgment. When you use Google Maps also, you have to use your judgment on where it is taking you. We have seen examples of people driving off a bridge because they were not paying attention, but you cannot, that doesn't happen to most of us, right? And the reality is that AI is a tool that can help you make the right decisions, but it cannot replace your decision making. Though we have also seen in some places that we have actually replaced decision making. For example, in the detection of tuberculosis on a chest X-ray, we are talking about Africa, where Kenya, for example, has the same number of radiologists or smaller number of radiologists than the city of Boston, right? So it's not enough for the whole population. There are so many countries in Africa where there is no radiologist available, zero. Some countries have 2 or 3. So there, if you are talking about reading an X-ray, it is time consuming. It takes weeks to get an X-ray read. And second is expensive. It's actually as expensive as getting an X-ray read in the US. So that is where, where we read X-rays, we are reading X-rays autonomously to detect TB on a chest X-ray. And the sort of fallback there is that when we say there is a TB on a chest X-ray, there is a sputum test that is done to confirm TB. So we are sort of ruling in, and then and then there is a confirmatory test. So that sort of works together well, as an autonomous tool plus a confirmatory test. But typically, I think you have to exercise caution in how you sort of bring autonomy into these use cases where there is no human available. And if you look at our AI tool for detecting TB, so many studies have shown that it performs better than human readers, right? So you have to think about where it becomes autonomous. And I also sort of bring that example of autonomous vehicles, right? Technology has been around for such a long time, but very recently, last couple of years, we have seen autonomous vehicles on the road, but that too in very limited cities. It's just within the San Francisco area. You cannot, if you want to go to the airport, you cannot go using the Waymos, right? The Waymos are available. And Tesla has a self-drive capability, but it's not fully autonomous, so you have to still be behind the wheel. So similarly, I think you'll have to do that with healthcare AI also. Over time, it can become autonomous, but I think right now, it can make mistakes, and you have to have a second layer of review.
I think just to build on that, you bring up a fascinating point, which is Cure AI used to be like you have moved from assisting radiologists to, building autonomous AI for, reading X-rays, for example, like you mentioned, right? But in your opinion, what conditions must be in place before human can safely step out of the loop to make it completely autonomous? Like take the, self-driving cars, for example. Are we there yet in terms of making AI autonomously read X-rays and give recommendations?
I think there has to be a fallback option always, right? I mean, I feel like if AI is accurate enough and the accuracy is 99.9, right? That is still 1 out of 1,000 cases that could be wrong, right? And so you have to think about it being so accurate that that number is maybe 1 in 100,000 or something really, really small, so that you're not making mistakes. Second is you also have to look at the type of mistakes that it makes. I mean, with AI or with any technology, right? It will make the same mistakes over any bug in any software. It will continue to make that mistake across so many systems, right? If there is a bug in the autonomous vehicle, for example, it will affect all the cars that are in the city, for example, right? So similarly, if there is a bug in our software, there is a mistake that our software makes, I mean, it will affect thousands of installations, thousands of deployments. So I think we have to sort of really look at very high accuracy rates. You have to have some way to provide a fallback mechanism that, okay, I mean, if it makes a mistake, how do you ensure that you catch that? And what are the types of mistakes that it makes? Is it fatal? Am I saying that ruling out lung cancer when, I mean, lung cancer is a possibility, that's a fatal mistake, right? If you don't diagnose it today, diagnose it 1 year later, it's probably, I mean, life or death for that patient, right? So, but if I make a mistake on something which is not that critical, maybe some calcified nodule, for example, on a chest X-ray, probably okay for the algorithm. So again, what type of mistakes is the algorithm making?
That's a fair point, yeah. So over to you, PT. One of the things that I'm a big fan of in what you say on a public platform is you often say scale comes after trust, right? Not before. How does that principle shape you when the organization uses patient data or AI models? What I'm trying to get at here is the ethos of 1mg, right, versus a startup mindset. How do you sort of, put that to practice in the principle that you hold in the organization?
I think it's a core fundamental value, at least in our organization. From the very beginning, we were very clear that there's no good healthcare business that can be built if you don't earn trust. And trust is not earned by any campaign or any marketing or messaging. It is about how you behave on a daily basis as an organization, what are your do's, what your don'ts. In fact, Nitin, I also grew up in Unilever, and I think that resonated very, very well with me because I had seen that at Unilever as well, and then I spent time at McKinsey. The way trust compounds was something that is very deeply ingrained, and to me, a healthcare business cannot be built till you have that fundamental thing in place, which is you earn the right to have a consumer trust you with anything. And we never had a marketing team for the first few years, but we always had a medical affairs team and a quality team in place. When we were very tiny, it was a small team also, but it was very clear to us that if we screw up on this, then we don't have a business. And I think our entire team kind of thought that was the obvious thing at that time, that marketing and all we can only do when we are very clear that everything else is in place. So that has thankfully served us very well. And at the end of the day, it is the core business strategy that do things, and shortcuts are so easy in healthcare distribution space, especially when you deal with medicines and lab tests, malpractices everywhere. Easy to get 15-20% additional margin if you just decide to buy from random places, and diagnostic sink tests are all over. They take your blood and throw it in the sink and give you a printout. All that is very easily common market practices. And from the foundation, it was very clear that there are absolute red lines. We will never do certain kind of things that compromise trust in any form, and it's okay to see what happens with the business, but those are basics. And I think that has really compounded well over. Of course, we've been very fortunate to survive to see it compound. So, but the fact that we are in a position where we are, a core thing has been that we are very clear about our red lines. We just don't cross those.
Oh, thank you. Now, I think staying true and honest to the core that you mentioned, pays the dividends.
And that part actually hasn't changed. It's not like now that we have grown, we think now we need to do more to. In fact, we've always been equally paranoid about trust. Quality issues, every single issue comes directly to me. Every quality review is one of the most serious and important reviews of whatever we need to do to make it better. And we try to make it better not only in our system, but also with our vendors, with the ecosystem. So it's kind of our DNA.
Thank you. Thanks for sharing that. PW, over to you. You have said AI delivers the highest impact where the specialists don't exist, the Africa point that you just brought up. But the question is, what do you do differently, or what should also India do differently to gain the leadership stature on a global platform by, doing things right?
It's a very, very good question, and something that I think a lot of people have thought about. And today if I look at it, US is there, here probably China is maybe slightly ahead, India is like way below, right? And India is still, I would say, ahead of probably every other country in this, right? But I think the AI, the foundation models, frontier models, I think we're probably too late to build that for the world. Maybe we can build foundation models for India, but again, is there a need for that or not, right? But I think where India can really do a lot, one is that when I look at application layer, right? You look at, I was meeting the chief AI officer of a healthcare system in the US just 2 weeks ago. And this is somebody, it's one of the largest systems in the country, right? And I was talking to him about how, he's an AI officer, so I was talking to him about how do you sort of think about build versus buy, right? And what are you building, what are you buying? And he said he sort of has a team that works on some use cases. One of the use cases that he talked about was automating calls to patients, right? So basically, instead of a nurse navigator calling patients, you would have AI call patients on behalf of the hospital. And he said, we're building that technology out. And I was like, who are you working with? How are you building it? And he said he's working with some Indian software companies on building that technology. And I won't name the companies, but he was actually working with Indian software companies on that. So I think when you look at AI, building AI agents to do these kinds of calls, to automate use cases, to automate workflows, for example, in a consumer products company as well, right? Those need to be built by somebody. And I think we are really good at doing that. We have been doing that forever. Infosys, TCS, one of our investors is Fractal, which does a lot of analytics work, right? But these companies have been working with Fortune 500 companies on building out software products for them, right? Or software use cases for them. Now, when it comes to AI use cases, I think we're in the right position to build that out for them as well. So I think that is one area where I think India has a substantial opportunity to still be that place where when you are building those AI agents, who's building those AI agents? Still, our companies from India are in the right position to build it out for them, because they don't have the, if I look at the US in general, you don't have the technology. Of course, there is deep technology expertise in Bay Area, which I don't think we can replicate. They are too far ahead, right? But when you look at the use cases being built for Fortune 500 companies, that is being done by India and can still be done by India, even with AI use cases. So that is, I think, and if you look at it, both OpenAI and Anthropic in the last week announced basically like a forward deployed engineer kind of model. They both of them announced like I think $4 or $5 billion each to set up a company which is doing services sort of model for on top of their AI, right? So these agentic workflows need services to be delivered to a end user. So that I think that's something which India should do well in and will do well in, I think. The second thing I think we have been good at is building digital public infrastructure, right? I mean, so we have the digital payments infrastructure, UPI. If you look at DigiYatra, that's amazing. I mean, I traveled so many countries, but I've not seen anything as effective as that outside of maybe Singapore immigration, but this is like just exceptional, right? And I think if you think about digital public infrastructure around AI and how we make, for example, healthcare AI accessible to patients, accessible to doctors, accessible to community health workers or PHCs, right? There is an opportunity for us to be ahead of the curve in that as well, even to government. I mean, not only in healthcare, but outside of healthcare also. So I think digital public infrastructure, AI as a digital public infrastructure is a huge opportunity, and the AI services, AI agent, building those AI agents for companies globally, I think India has a significant opportunity in both those areas.
Oh, fabulous. Those are good pointers. Just the last question before we turn to the audience to take some of the questions from the room. I think, PT, particularly, as I mentioned at the opening, AI blurs the line between pharma diagnosis and care platforms, right? How do you see the pharma platform relationship evolving over the next 5 years? Because it's more of a shift from competing with each other onto collaborating with each other for the betterment of the overall ecosystem, healthcare ecosystem, right? How do you see the platform relationship evolving?
Yeah, I think different parts of the ecosystem move differently, but on the whole, what I'm seeing is at least I expect healthcare to get much more integrated and much more personalized, and that would and more proactive, and that is driven by a very deep sense of what that patient at the end of the day wants or needs. Today, these are all discrete services that patients have to seek separately, because and putting them together is kind of left to the patient to do. I think platforms that are evolving now, and again, from the beginning, we've had the view that healthcare works best when it is integrated, because at the end of the day, it has to work for the patient. And that patient is served best when everything that is needed is in context of how it should be delivered. So just the way I frame it in my head is that as a patient, when you are inside a hospital, the doctor, the pharmacy, the diagnostics, the dietitian, all other support services are all together working in tandem, in parallel, in coordination to make you better, and then out you go. But the moment you go in the outpatient world, these are all individual shops that you are having to deal with and procure your products and services. Now with platforms coming in and data creating a common layer, that context and coordination that is key to better outcomes over a long period of time, that actually becomes genuinely possible. The consumer tomorrow should be able to see their progression, and it should be personalized to their condition and situation on their platform, that okay, to do better, this is what I need at this point in time, and this is how I can access it, or it'll get delivered to me. So I think healthcare as a model has to get much more patient-centric, in the sense that at the end of the day, we all are working to make the patient better. So whether it is products, whether it is services, whether it is information, context, everything should go with that view that yes, we are serving this patient and making that patient better. At the end of the day, if the patient is better for a longer period of time, we have a better opportunity to build and monetize the same well-being over a longer period of time. It's a win-win model. Everybody should be looking forward to that, and I think that is becoming more and more realistic now.
Thank you. That's really a promising future that we can dream of and make it happen in the time to come. So we have some time for taking some questions from the audience. If you can get a microphone.
Sorry. The mic. Thank you very much. It's a wonderful, quite a revealing, quite a insightful. Thanks very much. So much to learn in the last half an hour. Just one quick question which made me to think. In a high-risk industry like airlines, an aircraft is been using fly-by-wire for quite some time, where the risk is very high with 500 passengers, and they left it to AI and autonomous stuff to take you to land. Of course, there are some few accidents that has happened. They have used assisted, augmented, and autonomous, all three in the flight mode, right? For landing and takeoff, probably assisted, and pilot gets into play. What is the hesitation in healthcare to get inspired by airline industry, where they are talking about 500 people on the flight, they're taking responsibility landing and taking off, few accidents. Why is that healthcare industry so scared of dealing with? I know very well, I don't want to be a guinea pig, but the fact of the matter is, why can't we get inspired by airline industry?
I can take it. I think we should get inspired by airline industry. I think there is a substantial opportunity there. One thing I would say is still, the airline industry is not flying without pilots. There's always a pilot available to, autopilot is there, but it is in the hands of a pilot, right? So it's not full autopilot. And I think that will be the reality for healthcare also very soon, or maybe already is, right? Any radiologist in the US will have access to multiple AI tools across the world also, not necessarily in the US, right? People have access to AI tools. They are using AI to identify, annotate abnormal parts of that image, to maybe create an automated report, to create a summary of the impression. There is a lot of automation, but I think it's not at a point where it is operating without the radiologist, without supervision. And I think the same thing is true in airline industry also, where that supervision is there in case the autopilot makes mistakes, and it does make mistakes sometimes, which is where pilots have to land the plane in situations where they are, especially in situations which are not conducive for flying, right, with a lot of rain, a lot of wind. I'm not an expert, but I think we have seen that those situations, humans do come in and do sort of make decisions. I think healthcare is already very similar. So we'll probably question is, are we open to operating, at least my perspective is, are we open to operating without that physician at all? Can we have a patient talk directly to AI, which should be a reality, I think can be a reality, but are we ready for that? And maybe we are not right now, both from a liability perspective, and I think the biggest question is liability. Who's going to take the liability if the AI makes a mistake, right? That's one of the biggest challenges in my opinion. Second, I don't know if the AI is also ready for the accuracy level that is needed to be able to take decisions on behalf of patient, maybe diagnose disease, say that this is the drug that you should take. So basically end-to-end, I don't know if AI is ready for that kind of decision making, even to optimize, for example, automate, for example, primary care. Right? So.
Yeah, no, so I think my view on this is, airline is a much more well understood logical flow than complex conditions in healthcare, which are much more multivariate, and a lot of those variables are not well understood. So I think we'll have to look at different parts of healthcare a little differently. Of course, my view is that many times we make perfect the enemy of the good, and large areas of healthcare can actually be served so well by AI today itself, where what are you replacing is actually, there is nobody. You have a quack at best or nobody. And when you are talking relative to that kind of systems, primary care, so low-hanging fruit. I think that area is due for a significant impact first. As the AI systems and as the machines learn more and get more and more intelligent about the multiple variables at play, I think the more complex you go up the value chain in that sense. But healthcare, in my mind, is quite a lot more multivariate than the impact of an airline accident is very, 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 very severe. But I think the input-output variables are a lot more linear compared to what I see healthcare as. Right or wrong, I don't know. But I do feel that we'll get up the value chain, but there's a huge opportunity at the lower hanging fruit where you pretty much have nothing to, or the quality that you are replacing is not very hard to beat. So that's I think how it will work.
I think we are up on time. Apologies for cutting this short. We are pressed for time. We are catching up on.
Just a small question, if you allow. Yeah.
Okay, please go ahead.
Yeah. The question is that how much AI is being, in your own experience, how much of AI is being used by the physicians themselves? Okay, AI helping patients, I think, is a far-fetched. But how much is AI being used by the physicians in your experience across the world?
I think it's increasing rapidly, especially amongst the young physicians. And it's just, I think the framing is very important. It's like the physician having a absolutely fantastic assistant that has access to all the knowledge in the digital world at his disposal. And then, so it's very, very common now, and in the physician circles, people are referring to a bunch of AI models and tools just for confirmation, just for added information. Is same patient has come again, this thing did not work, anything else. So I think people earlier were chatting with each other in physician groups. Now they are talking to these AI systems also. So the change is happening. Is it something that every physician is doing? Certainly not. But I think what I am seeing, and we've also launched a doctor assistant for exactly helping the doctor get answers to the questions on their mind. And I think the receptivity is very, very high. So they are appreciating it. They're getting a free assistant that gives them context and information. So very soon, I think a doctor with AI will certainly have much more knowledge at their disposal versus a doctor without. So that's how, at least I see it.
Same here. I mean, I would say a lot of AI is being used by doctors in radiology. If you look at Open Evidence, the company, I mean, look at their products. I mean, doctors are using tools. I mean, yesterday I was talking to a radiologist who basically built his own agentic workflow. I mean, he pulls data from the EMR, then sort of looks at guidelines, national cancer guidelines, creates a report, inserts into the reporting system, all on his own. I mean, this guy he's built it in the US. I mean, he's in the US, but he's built his own workflow. And I think it will be easy. I mean, right now it is easy for anybody, any individual to automatically start using these agents. It does not require any coding, right, to create workflows that enable you. Of course, he's not automating it. He still looks at the report that is created and then reviews that, edits it, and then it goes out. But to create that report, I mean, you can start using AI. So it's about how quickly can people adapt to AI. And as PT said, younger physicians are more likely to do it, and they are doing it. I mean, I think there is a lot that AI will change in the healthcare, especially in clinical operations, and we see that changing. I mean, I've seen like change happen significantly in the last 1 year. I mean, a lot of people have started using AI in their workflows now.
Thank you, PW. So we'll call it a wrap, and PT and PW will be around if you want to catch them or the break and ask the question. Thank you so much for sharing your experience and perspectives, and I hope you got some inspiration and spark to take back and sort of adapt some of these things in your workplace going back. So thank you so much, and I appreciate you.
A big round of applause for our speakers, ladies and gentlemen. And to express our heartfelt gratitude, may I request our DG, Mr. Anil Matai, to kindly come up on stage and felicitate our speakers. Ladies and gentlemen, a big round of applause for all three of them. And now it's time for the most anticipated moment of the evening, the OPPI Annual Awards. Can we have the film, please? Over the years, the OPPI Awards have been recognized as a gold standard in the pharmaceutical industry, and the awards are given for excellence across various categories. For your information, there is a photo booth that we've placed outside the entrance. There's a trophy there which will be presented to all the winners. We'll request everyone to kindly click pictures, post them on social media with the hashtags OPPI Annual Day, Power of Partnership, and OPPI Annual Awards. And now, ladies and gentlemen, it's time for the first award of the evening, the Ranjit Shahani Memorial OPPI Award for Excellence in Patient Centricity 2025-26. This award recognizes and felicitates the pharmaceutical company that advocates for patient rights. And for that, I would like to call upon first Mr. Bhushan Akshikar, President OPPI, and Mr. Anil Matai, Director General OPPI, to join us on stage for the award ceremony. We are honored to have Dr. Indu Shahani and Mr. Siddharth Shahani with us today. So may I graciously invite both of you to join us on the stage for the felicitation of this award. This award, ladies and gentlemen, holds a very special place in our hearts. We would also like to thank the jury members who have carefully evaluated the nominations, and may I request the jury members who are present in the audience of this award category to kindly join us on stage. The jury members for this award category are Dr. Indu Bhushan, Dr. Ratna Devi, Mr. Prasanna Shirol, Mr. Raj Shankar Ghosh, Ms. Ranjita Vinil, and Ms. Vijay Venkatesh. May I request Mr. Siddharth Shahani to announce the runner-up? Yes.
And the runner-up for the Ranjit Shahani Memorial OPPI Award for Excellence in Patient Centricity 25-26 goes to Novo Nordisk India Private Limited. Heartiest congratulations.
Can we have the team on the stage, please? Thank you. Congratulations. Now going ahead with the winner announcement, may I request Dr. Indu Shahani to announce the winner, please.
And the winner for the Ranjit Shahani Memorial OPPI Award for Excellence in Patient Centricity 2025-26 is Roche Products India Private Limited.
Can we have the team on stage, please? Congratulations. Thank you. Thank you to the dignitaries for gracing this occasion. And may I request Mr. Matta and Mr. Akshikar to kindly stay back on stage. Moving on to our next award, Dr. H.R. Nanji Memorial OPPI Marketing Excellence Award 2025-26. This award recognizes and rewards brilliance in the field of marketing, celebrating the finest minds within this profession. We have two categories under this award, the existing pharma product and the new pharma product. So may I now request the jury members for this award category who are present with us in the audience to kindly join us on stage. The jury members for this award are Ms. Archana Jain, Mr. Jitendra Tyagi, Mr. Praful Akali, Mr. Salil Kalyanpur, and Ms. Susan Zosi. Let us begin with the first category of Dr. H.R. Nanji Memorial OPPI Marketing Excellence Award, which is the existing pharma product. And may I request Mr. Matai to announce the runner-up, please.
And the runner-up, hi Praful.
Praful's here, yes, thanks Praful.
And the runner-up of the Dr. H.R. Nanji Memorial OPPI Marketing Award 2025-26 for existing pharma product category is, who could it be? No, any guesses? No, you'll only guess the winner, okay. Novartis Healthcare Private Limited. For outstanding performance in the marketing of Triaxana.
Can the team from Novartis kindly make themselves to the stage, please? Thank you. A big round of applause, ladies and gentlemen. Thank you to the team. Congratulations again. Now going ahead with the winner announcement, may I request Mr. Akshikar to announce the winner, please.
And the winner for the Dr. H.R. Nanji Memorial OPPI Marketing Excellence Award 25-26 for existing pharma product is for the outstanding performance in the marketing of Darzalex Johnson & Johnson's Private Limited.
Congratulations, team, and can we have you all on the stage, please? Congratulations, winners. May I request the OPPI leadership and the jury members to stay back on stage for the next category. This is the new pharma product under Dr. H.R. Nanji Memorial OPPI Marketing Excellence Award. And may I request Mr. Matai to announce the runner-up, please.
Runner-up of the Dr. H.R. Nanji Memorial OPPI Marketing Award 2025-26 for new pharma product is for the outstanding performance in marketing of Lokelma, AstraZeneca Pharma India Limited.
Can we have the team on the stage, please? Congratulations, team. Going ahead now with the winner announcement, may I request Mr. Akshikar to announce the winner.
And the winner for the Dr. H.R. Nanji Memorial OPPI Marketing Excellence Award 25-26 for the new product is none other than Monjaro, Lily.
team. Thank you to our jury members for joining us for the felicitation. Moving to the next award category, the OPPI Healthcare Communications Award 2025-26. This award recognizes creative communications from our members operating in this highly regulated industry. It's targeted at practitioners, patients, and consumers' work that brings science and innovation to life. May I now request the jury members for this award category who are present amongst us to kindly join us on stage. The jury members for this award are Mr. Aman Gupta, Mr. Dilip Yadav, Mr. Shrikant Srinivas, and Ms. Viveka Roy Chaudhary. In this award category, there are 2 runners-up and 1 winner. So may I request Mr. Matai to announce the runner-up, please?
The runner-up for OPPI Healthcare Communication Award 2025-26 is Johnson & Johnson Private Limited. Congratulations, team. Now, like I said, there are 2 runners-up, so we'll request Mr. Matai to do the honors. The runner-up for OPPI Healthcare Communication Award 2025-26 is once again Roche Products India Private Limited. Moving on now to the winner announcement. May I request Mr. Akshikar to announce the winner?
I don't think there are any surprises on this one. For everybody who's been through any airport in the last 12 months, the winner of the OPPI Healthcare Communications Award for 25-26, we go with you, Novo Nordisk. Yeah, can we have the Novo team here? Big round of applause.
Congratulations, team. The next award for the evening is the OPPI Diversity and Inclusion Award 2025-26. This award recognizes the organization that has diversity and inclusion at the heart of its business, providing outstanding support and opportunities to women, people from the LGBTQIA plus community, and people with disability and other minorities. So may I now request the jury members of this award who are present amongst us to kindly join us on stage. The jury members for this award are Ms. Deepa Shankar, Mr. Karthik Ekambaram, Dr. Neeru Kumar, Ms. Roma Balwani, and Ms. Sonika Aron. A big round of applause to our jury, ladies and gentlemen, for showing their commitment and support. May I request Mr. Matai to announce the runner-up?
And the runner-up for the OPPI DNI Award 2025-26 is, there are only two companies which have been dominating the country in the past few months. One just got an award, the other one is ready to come up again. That's Eli Lilly and Company India Private Limited.
Requesting Mr. Akshikar to... Okay. Yeah. Ma'am, we have to announce the winners. Thank you so much. Yeah, can we have you announce the winner, please, Mr. Akshikar?
And the winner for diversity and inclusion. I'm just checking how many were attentive. It's been a long evening. I just want to check. None other than Novartis Healthcare Private Limited. Big round of applause for them.
Congratulations, team. Thank you to our jury. Moving to the next award category, the OPPI HR Excellence Award 2025-26. This award will be bestowed upon organizations that have achieved an overall excellence in their HR and people management practices. And may I request the jury members who are present amongst us to kindly join us on stage. The jury members for this award are Ms. Ashwini D. Prakash, Mr. Kavi Arasu, Mr. Sanjay Banerjee, and Ms. Shilpa Gentila. In this award category as well, there are two runners-up and one winner. So we'll start with the runners-up first. Requesting Mr. Matai to announce the runner-up, please.
And the runner-up for HR Excellence Award is MSD Pharmaceuticals Private Limited.
Congratulations, team. As I said, 2 runners up before, so we'll request Mr. Matai to do the honors.
The other runner-up for HR Excellence Award is Novo Nordisk India Private Limited.
Congratulations, team. And now let's move on to the winner announcement. May I request Mr. Akshikar to announce the winner.
And the winner for the OPPI HR Excellence Award is, once again, Eli Lilly and Company.
Congratulations, Winslow. Thank you to our jury members. The next award category for the evening is the OPPI Medical Excellence Award 2025-26. This award honors outstanding achievements across various medical disciplines within the pharmaceutical industry. And may I now request the jury members present amongst us here today to join us on stage. The jury members for this award are Dr. Arun Bhatt, Dr. Milind Antani, Dr. Purvish M. Parikh, Dr. Rashmi Kulshrestha, and Dr. Suresh Menon. May I request Mr. Matai to announce the runners-up? I thought so.
The runner-up for Medical Excellence Award 2025-26 is Pfizer Limited.
Congratulations, team. Request Mr. Akshikar to now announce the winner.
Well, everything we do in this industry is on the moral high ground of science. And the winner for the Medical Excellence Award 25-26 is AstraZeneca.
Congratulations and thank you, team. The next award category is the OPPI Salesforce Excellence Award 2025-26. This award recognizes outstanding work in the fields of Salesforce and commercial effectiveness. May I request the jury members who are with us today to join us on stage. The jury members for this award are Mr. Ariz Rizvi, Ms. Gauri Pathak, and Mr. Pawan Garg. Now in this award category as well, there are 2 runners-up and 1 winner. So we'll request Mr. Matai to start with the runners-up, please.
The runner-up for Salesforce Excellence Award category is Bayer Pharmaceuticals Private Limited.
Congratulations, team. As I said, 2 runners-up, so we'll request Mr. Matai to announce the runner-up, please.
So the other runner-up, Salesforce Excellence Award category, yet again the guy who has brought an extra bag all the way from Bangalore, Novo Nordisk India Private Limited.
Congratulations, team. Going ahead with the winner announcement, may I request Mr. Akshikar to announce the winner of this category.
For our industry, the commercial engine still depends pretty much on our Salesforce teams. And the winner for the OPPI Salesforce Excellence 25-26 is Novartis Healthcare Private Limited.
Congratulations, team. Now, ladies and gentlemen, moving to the last category of the evening. Some more smiles, please. It's the last category, so we'll wind up after that. The OPPI Sustainability Excellence Award 2025-26. This award recognizes the pharmaceutical company that goes beyond traditional business practices to make a positive impact on society through their innovative and sustainable initiatives and strategies. May I request the jury members present with us today to kindly join us on stage. The jury members for this category are Dr. Pragya Ram, Mr. Ravi Menon, Mr. Sanjeev Navangul, and Mr. Yugal Sikri. In this award category as well, there are 2 runners-up and 1 winner. So may I request Mr. Matai to announce the runner-up?
The runner-up Sustainability Excellence Award is ACG. Ajit Singh ji.
Congratulations, team. May I request Mr. Matai to announce the runner-up?
The other runner-up in Sustainability Excellence Award goes to Pharma Point India Private Limited.
Congratulations, team, and thank you. Going ahead with the winner announcement, may I request Mr. Akshikar to announce the winner? This is the final award, ladies and gentlemen, so let's please have some energy in the room.
Should I take my own time to prolong it? Yeah, it's a sustainability award, right? So I'm just thinking.
Let's sustain the momentum, ladies and gentlemen.
Well, the winner for the Sustainability Excellence Award 25-26 is Sanofi India Limited.
team. Thank you, Mr. Matai. Thank you, Mr. Akshikar, for staying with us through the ceremony. Just sustain this momentum for 2 more minutes. We need to definitely thank everybody who's involved in setting up the ceremony today. So first of all, a huge congratulations to all our winners and to you all for being such a kind audience and sustaining this momentum through the show. We extend our sincere gratitude to our esteemed chief guest, Mr. Nitin Paranspe. Thank you for staying us through the show, sir. And to the panelists for the evening, Sampath and Prashant T and Prashant W, thank you so much for being a part. A heartfelt thank you to the OPPI leadership team, to our president, Mr. Bhushan Akshikar, president-elect, Mr. Amitabh Dubey, and our DG, Mr. Anil Matai. Thank you for your leadership and guidance. A big thank you to our esteemed partners, our gold partner GSK, our logo partners AbbVie, Bayer and Novartis for their unwavering support. To the jury members and to our event management team, Pink Crowds, thank you Manish and team. Last but not the least, the OPPI team who's worked behind the scene to put up this show. So thank you Clara, Cheshta, Ankit, Masood, Bhumika, Prashant, Prem, Mahesh and Dharmendra. It's been a pleasure to host you all. I'm Asavari Sathe. Namaste, signing off. The bar is set high and is open now right behind all of us. Thank you.